morning and welcome to Public Health for Women by Women. Today we are kicking off National Women's Health Week with a panel discussion featuring 5 amazing leaders in the world of public health from our Region 6 office located in Dallas, Texas. My name is Lieutenant Monica Geiger, and I am the Regional Women's Health Analyst in the Regional Office of the Assistant Secretary of Health. If you are interested in learning more about National Women's Health Week or about our office, I will place the links in the chat box where you can learn more. So those links will take you to the National Women's Health Week page, as well as our Region 6 page. And in case you are not aware, the Department of Health and Human Services has 10 regional offices across the nation. And we encourage you from wherever you're calling in from to find your regional office and engage with us if you ever need anything. Today, we will have an opportunity to learn a little bit more about what the Department of Health and Human Services is doing to further public health, and we will get a chance to hear about each panelist's leadership journey. I want to thank all the panelists for joining us here today. I really appreciate you making time in your busy schedules as you endeavor to save the world, one public health measure at a time. For everyone listening today, we encourage you to place your questions in the chat box, and we will get to as many as possible. So without further ado, I'm going to allow the panelists to introduce themselves, and I would like to hear, what was the moment that you knew you wanted to work in public health? So first up, we have the regional director herself, Sima Ladjevardian. Would you care to introduce yourself and your program?
Good morning, everyone, and thank you so much, Monica, for allowing us to be here. It's just such an honor to be here with all my amazing colleagues on this panel, and happy Mother's Day to all. So I am the regional director for the Department of Health and Human Services in Region 6. We all cover the states that are behind me, which is Texas, Arkansas, Oklahoma, Louisiana, New Mexico, and 68 federally recognized tribes. I always want to say that it's the most eventful and the most exciting region in all the regions that we have. Our office specifically, what the regional office does is really kind of like the front door to HHS in this area. And we, on a daily basis, we really engage meaningful dialogues with governors, mayors, tribal leaders, partners, stakeholders, and really to let everybody know about HHS policies, programs, regulations, grants, and to ensure that health and human services policies, programs, and regulations are informed by all the experiences that you're having. And really we're able to listen and are able to help you back on that. Monica, I wasn't sure if you want me to talk about our journey, but I think what you asked us to do is first just kind of describe what we do. So I'm gonna stop here and let my next incredible colleague go ahead with that.
Thank you. So next we have the Regional Administrator for the Administration of Children and Families, Lakesha Pope-Jackson. Would you mind introducing yourself and sharing with us what was the moment you knew you wanted to work in public health?
Thank you, Monica, and good morning to everyone. My name is Lakesha Pope-Jackson. I'm the Regional Administrator for the Administration, Children and Families. And when we hear Health and Human Services, the ACF is the human services side of HHS. A lot of times that goes without saying, but when we speak of health, we're really speaking of the human services side of determinants of health. When you talk about what was the moment that I knew that I wanted to go into, for me, human services or public policies where I got started, it was actually, I was a teacher, I was a preschool teacher. And I realized that my students and their families were dealing with issues and really things that were just so much bigger than them. And that really led me to public policy, because while I did feel I was making a difference for the students that I had in my classroom, I really wanted to make a difference on a broader scale. And that's what led me to human services.
Thank you so much. We appreciate you. And so Also on our panel today is the Regional Administrator for the Centers of Medicare and Medicaid Services, Shannon Hill. Would you care to introduce yourself, please?
Absolutely. And good morning, Monica. And we have 102 people and counting. And so good morning to each of you. We're so excited and really privileged that you joined us this morning. So I am the Regional Administrator for the Centers for Medicare and Medicaid Services. So we have two M's in our name, but we really like to refer to the third M as well, which is marketplace. So think of the Affordable Care Act and in really ensuring that every American has the right to accessible, comprehensive healthcare. And so CMS does everything from innovation, really looking at new ways of delivering care and really incentivizing providers to do so. Value-based payments, how do we pay providers in a way that really increases the quality of care that is being provided? And then health equity, really how we're ensuring that across the landscape that we're really addressing the needs of individuals in the system. And when did I discover that public health is what I wanted to be? So I've been active my entire life. I was a college cheerleader. I used to be an aerobics instructor. And I think it was really just that sense that I heard someone say one time, if you don't take care of your body, where are you going to live? And that may sound kind of corny, but that really struck me. And then I realized that as much as we can do as an individual, systems are bigger than us. Some communities just live where there's more health challenges or pollution or things that they can't control. So that's really what drew me to public health, was just my love, yes, for doing what we can ourselves to be healthy, but really working with regard to systems and policies to ensure that everyone has that access to be able to live a healthy life. Thanks, Monica.
Thank you so much, Shannon. So next up is Commander Luz Rivera, who is the Regional Director for the PACE program, which stands for Prevention and Community Engagement, and the Ending the HIV Epidemic. Welcome, Luz. Thank you for being here.
Thank you for having me. So when I think what shaped me to become a leader in public health, I think that protecting and improving the health of people and their community is something that I learned by an amazing role model that I had in my life. She's not with me anymore, but I learned from her never to give up. The only constant in life is change. So renew yourself and be ready for it. As a woman, you can tackle everything. Increase your learning and seize opportunities. And take up control of the moments when you need to be assertive. Be able to say what needs to be said, especially if you have the opportunity to voice the needs of those that do not have a voice. And she always said, yeah, we were all created equal. When I think about a specific personal story, I could think about serving in Ecuador and training and working with children that were living and working on the street. And I had the opportunity to train this boy. He was only 11 years old. He was someone working on the street, had no house. And I wanted to take him to a competition where the person that would win the competition will represent all the children and youth in New York before the United Nations. And having a whole organization that was not motivated due to social bias, due to discrimination, and the treatment that street children were getting in Ecuador did not stop my spirit. That was motivated by the conviction of that role model and my mother, that as a woman, you can tackle everything. I could let you know that as a result, this street kid did win the competition, did go to New York City, and everybody in that institution learned that the children were able to reach anything. So as I learned from my mom, I mean, the only constant is change and we could achieve everything. That's why I'm here. Thank you.
Wow, such powerful words. Thank you so much, Commander Rivera. So finally, we have the acting regional administrator for the Human Resources and Services Administration, Commander Sharyl Trail. Would you mind introducing yourself?
Sure thing. So good morning. And it's actually kind of nice to go last because I would say there's a lot of overlap in what all of my colleagues have already said this morning. So good morning. I'm Sharyl Trail. I'm a licensed clinical psychologist by training and spent the first 11 years in the U.S. Public Health Service at a variety of Indian Health Service duty stations as a clinician, clinical supervisor, and healthcare administrator. And for the last year, I've been the acting regional administrator for HRSA here in Region 6. So a little bit quickly about HRSA. HRSA's role as far as supporting maternal child health goes across multiple offices and bureaus that HRSA runs. And our real main target is to increase access to care. And so we provide significant amount of primary care for young children, for children and mothers in rural areas. Also with the Bureau of Health Workforce and multiple scholarship and loan repayment programs, our goal is to increase access to the types of providers that women and children need in their lives that they might not have access to otherwise. And the Bureau, the Maternal Child Health Bureau runs some specific programming, mainly our Block Grants and Healthy Start program, really zeroing in on the health of 0 to 3. So the things that HRSA does absolutely ties into why I'm interested in public health. I've been in the helping profession since undergrad. I did AmeriCorps in Eastern Kentucky. I was a bachelor's level case manager for 10 years, managed folks' Medicaid waivers, and worked for many years in the developmental disability world around advocacy. And I think, and then as I went to school to become a psychologist, what I really saw over time is that individual strategies only take us so far. So like my dedication and real love of public health is what my colleagues have said already, which is really looking at structures, policies, systems that either enhance someone's ability to fully engage in society, or the same structures, policies, and systems that make it harder or disadvantage people to really fulfill their ability to be a citizen, to be a family member, to be a community member. And so my connection, what I try and do is connect, my love of public health and prevention with my love of psychology, and really trying to use the science and this work to really work on some more of these what we would call upstream strategies. Yeah, thanks for having me here today, Monica.
Thank you so much, Commander Trail. We really appreciate you being here. And then I wanted to circle back to Sima for a moment. So what was the moment that you knew that you wanted to be in public health?
I mean, I listen to all my colleagues' stories, and I think we all share our passion of helping people out. And I think my story just started when my family and I had to escape political upheaval and revolution and come here, really to this beacon of hope with a few faded pictures and a bunch of big dreams. And really throughout my journey as an immigrant, and I saw what the power and promise that this country can provide and the hardships that are out there. And, being an immigrant, being an attorney, being a mother, being a cancer survivor, a community advocate, all of that has led me to make sure that hardworking families really have all the opportunities that they need to strive and be healthy. And I think that's what brings everything together. It's really in the public health arena to make sure that we address and empower people to be able to lead those lives and do that.
Thank you so much. Such powerful words. And I'll just say, immigrants, we get the job done. From Hamilton. But so the first panel question that I'd like to put out there for everyone to discuss is, did you have a role model growing up? If so, how did that role model influence the leader that you are today? And if not, how would girls who aspire to enter a STEM field benefit from seeing more women like you guys in those fields?
I don't mind starting. It's a pretty quick story, but after I did AmeriCorps and had graduated from undergrad, I was a live-in nanny, and the mom was a neurobiologist at the University of Kentucky, tenured faculty member, really developing innovative science around recreating nerve cells so that people with spinal cord injuries could someday walk and move again. And so not only did I live with her for a couple of years or work for her, but she really took this opportunity to help me try and figure out, as I was in the in-between of what was next for me. And as I tried to brainstorm master's level work, she and I both were from Ohio, both from working class families. She was the first in her family to get a doctorate degree. And so she was not dismissing my goal to get a master's degree. But as I was thinking through options of next steps, she really just pushed me in a way I had never thought before. So if you wanted to get a master's of counseling, what about a doctorate of psychology? If you want to get a master's of public health, why not go to law school? Like really, really showing me that coming from a working class family, that higher education was supported, but was not necessarily modeled, that we could also kind of strive and attain these highest level degrees. So really important in my life.
I'm happy to go next. So the person that I've always looked up to, really my beacon of hope, has always been my grandmother. She was a tireless advocate for women's rights, and she went way back when she became one of the first women in Congress in Iran and helped pass the women's right to vote then. And she always taught me that you can make a difference if you're passionate, prepared, resilient, and as Commander Trail said, education is so important. And if you put all these skills together, and you really can make a difference. And I can't tell you how much influence she had. And as an adult, I've had a role model. And that's when I was going through my cancer treatment. Her name was Edna. And I was privileged to have access to good healthcare while I was going through all that. And she was having a very hard time holding two jobs, taking care of family, thinking about paying rent, whether she can get treatment. And she was just such an incredible beacon of strength that she has become now my role model to make sure that, with all the adversity coming her way, she was able to fight through it and take care of her family and be there. And I think as women, so many of us have to deal with all the different hats that we have. So she sadly passed away, and she'll always be one of my beacon of hope.
As I mentioned at the beginning, my role model was my mom. And just a little bit background about her. I come from a couple of adolescent parents. They got married when they were 15 and 16, so they didn't even finish junior high school. But even though that was a reality for them, my mom never stopped teaching me and encouraging me to achieve more. My mom didn't expect me to be an adolescent mother like she was. So I grew up with adolescent parents, so my view of life was so different. And she just helped me to be able to achieve anything that I wanted to achieve. It was never stopped. And as an adult, I have had the privilege to meet great leaders that have helped me follow the path. And I have to mention two that are very important for me, and is Rear Admiral Trent Adams and Dr. Woodcock from FDA. And both of them, because I had the opportunity to talk to them and find out their struggles and how they were able to achieve what they were able to achieve in life. And surprisingly, it's so similar to what my mom, women marry at 15, told me. It was so similar to what I'm learning from professional women that are in the field. It's so similar. What I learned in graduate school, I'm also a clinical psychologist. I learned so many things in graduate school from theorists, but my mom was telling me, and she never went to school. So yeah, she was the greatest role model for me. And even though later on in my life, I have not met great professionals, what I learned from my mom is the basis for who I am today.
That's beautiful. And I'll share that my inspiration was my grandmother. She was one of the first women in the Navy during World War II. And seeing her put on the uniform and being so proud inspired me. And would anyone else like to share?
Monica, I'll go. I, like many that have already gone before, I would say that my mother was definitely my greatest role model. I actually was the first in my mother's side of the family to graduate from college and, of course, to go on to get a master's degree. But my mother started as a receptionist for a for-profit company, New York Life, and she actually retired as a senior executive vice president. She worked her way all the way up, and really provided really just an example for us that was unparalleled. She did not allow herself to be stopped by the limits of education, and many times she was the only African American woman in the boardroom. But she went in there strong, and she really inspired us to do the same, to go in and to stand our ground and to speak speak truth and to represent what we knew was right. And that really made a big difference. And in light of that, my father was also a military officer. He was one of, back in the day, very few African-American officers. And so that I also wore, very much so as kind of a sense of pride in terms of being his daughter. And so I was definitely a product of the village, without a shadow of a doubt. I grew up in Austin, Texas, and in New Orleans. And so, that really, it was a very small kind of knit community, and they wrapped their arms around those who wanted to do better, really, and wanted more. And I think that made a significant difference for me in terms of being inspired and having, like Lou said, constant role models in front of me, encouraging me to push past what I thought were limits. And that really did inspire me as a female and as a female professional.
So Monica, I'll go ahead and round us off. So like all of the panel members have said, family's always a huge difference, and I stand on their shoulders every single day. But there's two women that I'd like to specifically mention. One is a woman named Gail Trapala. Many, many moons ago, she was the regional administrator at then HCFA, the Healthcare Financing Administration, which is the organization prior to CMS. And what was so impactful about Gail was she began her career and then she stepped away from her career for about 15 years to focus on being a mom. That was what her family decided was the focus and the best path for her. And then once her children were at an age that she could she re-entered the workforce. And it just really propelled me of a woman who was mid-career stride, stepped away, and was still able to ascend. And she really just demonstrated to me that make your path. This was my path, but make your path. And why that was so impactful was I was working for then HCFA, but fell in love with Head Start, fell in love with ACF. I was a presidential management fellow. And so I had the opportunity to go and visit lots of different programs. And when I fell in love with Head Start, it was that you can't leave. Someone brought you into the agency, you have to stay here. And I was really looked at almost like the scarlet letter, like, oh my God, she's going to leave. And I just remember her words, follow your path. And so I did, and I worked for ACF for a number of years. And then my second mentor that I'd like to mention is a woman by the name of Katrina McGee. She was a single mom, became a mom her freshman year in college, didn't drop out, continued on through college. She is now the senior vice president of the American Heart Association. doing a phenomenal job. And I just watched the way she was a great mom, a great career mentor. And she really had that same, I worked with her for 2 years at the American Heart Association, loved that work, but really missed more of the policy side. And she said the same thing that Gail said to me many, many years ago, follow your path. And so that's what I think so many of the mentors have done in my life with those two women in particular, is that their lives were an embodiment of one to be followed, but they were always very clear to help me find my path, not to try to emulate them, but to find the best path for me.
Wow, all such powerful stories. Thank you so much for sharing your personal stories. It means a lot. So now I want to get into a little bit. How is your operating division promoting women's health and well-being? Really quick, I know we have representatives from all different operating divisions, and you're all doing amazing work in women's health.
I'll just go ahead and jump in. So I'm going to be sure. I'm going to go last and then go first. So I think CMS is doing a great job. One of the things that CMS has is a number of what we call employee resource groups. And those are opportunities to be able to connect with like-minded individuals on affinity. So there's women that are represented in those groups across the landscape, but there's also one that just focuses specifically on the needs of women in the organization. And being that we are a healthcare financing organization, we're really broadening that to be a holistic organization, holistic in the way that we are delivering healthcare to the consumer and holistic in the way that we are meeting the needs of individuals as well. I'm very proud to say that CMS is 67% women. And of that, if you look at the senior executive service, GS 15 and above, we are 59% women. So CMS has a number of women at the helm that I think lead with that strength, lead with that opportunity to say what's meaningful, what's valuable, how can we help, how can we support. So I'm really proud of CMS's focus on being a listening organization. Even those of us on this panel, as great as we may think we are, we're only as good as we're able to listen to those that we have the privilege of being able to work with. And I think CMS is doing a great job doing that.
Shannon, I think that's a perfect segue for what the work that we do here at Administration for Children and Families. And as you mentioned, it's really about partnerships and how we actually work with states to promote the economic and social well-being of children, families, and communities. And when I talk about human services, we really are talking about encouraging positive impacts on quality of life. And we know that it requires healthy women, because we cannot have a quality of life without some woman in our lives, whether it's a parent, a teacher, an auntie, a mentor, whatever it may be. But we know that they play major roles in the development of children. And so that's really the focus and the overall mission and the overall strategic goal of what we're trying to do at the Administration for Children and Families. There are actually, I'll run through this quickly, but in May, there are so many, it's a month of recognition, let me say that. So we've got, we have a brand new assistant secretary. So we have an ACF assistant secretary, January Contreras, and we're so proud and happy to have her. And just recently, last week, she recognized the National Day of Awareness for Missing and Murdered Indigenous People for, of course, with our Alaskan Native, American Indian, Native Hawaiian, and Pacific Islanders. But it used to be called Missing and Murdered Indigenous Women. And of course, we want it to be more inclusive with people. But as we know, the focus really is on the health and safety of women. And so that was really one of the things that I wanted to mention, that it's going to take not only the president acknowledging that we have to work with our tribal leaders, but also ACF being very intentional about the work that we're doing in order to really preserve the health and safety of vulnerable women, particularly of our tribes. It's also National Foster Care Month this month. There's so many, right? But when we talk about health and safety of women, so many of our women primarily lead homes, and we're trying to prevent abuse and neglect because of those struggling with substance abuse and mental health issues, which I know that we're all familiar with. But the Children's Bureau and ACF really is committed to that primary prevention, and how do we keep families together. In addition, it's National Teen Pregnancy Prevention Month. So, I mean, like, again, we really are being very intentional about how we can look at the health and safety of not only women, but girls. And just as Luz mentioned, the incredible strengths that adolescent parents can give us, but also we know that the barriers and the challenges that they run into. And so this is another way in which, ACF is really looking at what we can do to support. And then lastly, I just want to mention that most recently in the American Rescue Plan, many of you know that there was an additional almost $800 million to support domestic violence and survivors. There's a resource network that FISB has put together because we know that it takes a coordinated network really to help those survive. And so I just wanted to point those out in terms of what the Administration for Children and Families are doing, particularly around supporting and promoting not only the health of women, but also their children.
And we can share those links too if you have some resources, because that's great information.
Absolutely.
So for us in OIDP, we are committed every single day to end the HIV epidemic with all the priority population that we serve. And we're committing to women's health through our ongoing work to overcome disparities, promote support and access to care for all women, and increase availability and accessibility to HIV prevention and treatment tools. We serve everyone self-identified as women, cisgender women, transgender women, and genderqueer that is living with HIV or at risk of acquiring HIV, ensuring their quality of life in every stage of a woman's life cycle as the main goal. This goal is as it was defined and requested by women in Region 6 during listening sessions. We are very active in working in reproductive age and testing for HIV, STIs, and linked to care, alternatives available for HIV prevention and what women in Region 6 are telling them, prevention considering the perception of risk, communication, negotiating with partners, interpersonal violence, relations of unequal partner, and aging with HIV. We make sure partners are aware in their concerns from Region 6 and that women's voices are known and are part of the decision making. We follow through and we make sure their concerns are acted upon. And the goal is to have resources, research, funding sources, responding to the voices of the women in Region 6, because we know that that's the only way that we're going to be able to end the HIV epidemic by the year 2030. Thank you.
So
Beautiful.
As the regional office for HHS, we work a lot in partnership with these incredible women that are on this call with their various programs. And we work really as conveners of stakeholders to listen, provide information, and really help on the various priorities that the department has. But I just want to go very quickly what affects, I think, women so much on this. Health equity is one of the overarching theme that we're emphasizing on, and it really permeates into everything that HHS does. And there is, and I think the pandemic has just made it even more clear that it's not a reality, and too many Americans, or especially in racial and ethnic minorities, need access to that. So as such, the president has signed an executive order directing all of us, to be empowered to take that on. Within that, obviously, like what affects women a lot is access to high quality, affordable healthcare, because that is something that really empowers us to be able to survive and do other things. Maternal health is something that we work very closely with. Sadly, we are rated really, really low on the spectrum. And we're doing a lot of work on that to make sure. And I know there's all these grants and opportunities, but we're holding listening sessions. We are making sure that everybody knows, what resources are available. And we're convening different events throughout the region to make sure that, we put emphasis on that. And especially within, Black and brown women are roughly 2 to 3 times more likely to die from pregnancy complications than non-Hispanic white women, regardless of income and education level. So we're really trying to address that. And I know, HRSA, through their, the organization, there are many grants going towards that direction. Of course, reproductive health care, it's something that we're really concentrating on. And Secretary Becerra last week committed, doubled down on our authorities to protect every American's right and access to reproductive health care. And mental health is one of the big priority of, HHS as a whole and the administration, really making sure that mental health and health are on equal parts. Sadly, the CDC has put out really staggering statistics, showing how much we've had drug overdose deaths, how much suicide, and especially in our youth. So we're giving specific attention on mental health to support, all of our constituents. So many things we're focusing on, all of this wanting to empower women to be able to have all the tools that they need to deal with their work, with their children, with the many different hats that they have on. Thank you.
I think I had shared kind of in my intro a little bit more about HRSA, but just what Director Ladjevardian had just emphasized, some of the HRSA programming is for sure the goal is increased access to care, but increased access to quality care. And so because a lot of what HRSA funding does actually provides patient care, we're really working on decreasing the morbidity and mortality of women and all people that identify as women and their children, and especially young children. I guess one more thing that I would highlight that's really important that we've been focusing on specifically in Region 6 is really looking at the healthcare workforce, and the healthcare workforce predominantly being women, and the more entry-level positions having more women than higher level positions with greater levels of education. So our goal in Region 6, as we've been really looking at the health and well-being of the workforce, is how do we focus on burnout mitigation and resiliency, but specifically with the entire health workforce in Region 6, of course, but really looking at women for sure. And how do we help also, one of the goals is, part of health equity is to have your health professionals represent who you are in your community. So how do we enhance these career opportunities for young girls, and even having conversations way down into middle school of like what it would look like in the communities where federally qualifying health centers are, where there's health professional shortage areas, to really help increase that career pipeline. And that kind of goes back to, my experiences. It takes usually someone who did that, because it's maybe as you have blinders on of maybe where you think you can go in your life, to see other people explain other routes. And so all that is really working towards health equity, because our programming is really looking at the disparities, whether it's income disparities in the health workforce and women, whether it's maternal child health outcomes during pregnancy and birth, all of these things, and then really trying to look at how our funding and programming can enhance the quality of of care. And I know CMS and I mean, a lot of our agencies, there's just so much centricity around this, you know, whether we're reinforcing this, you know, quality care by regulation, reimbursements. And so it's just exciting to kind of see the region have so many shared priorities.
Wow, that's awesome. Thank you so much for sharing. So in about 5 minutes, we're going to turn to questions from the audience. So audience, please continue to put your questions in the chat and we will be getting to those momentarily. Meanwhile, I did want to ask Commander Trail and Commander Rivera, we wear the uniform of the United States Public Health Service. Can you speak to what that uniform has meant to you as a woman?
I don't know, ma'am, if you want to go first, I can take a crack at it.
Well, for me, because there's a history in my family of people that have worn the uniform and people that have died in service. And because my brother is in a wheelchair because he's protecting the safety of all of us. You know, he was in Iraq and he served for 16 years in the US Army. And now he is someone that is injured. But I learned that dedication and what they were willing to do for our country and for everyone without thinking I need to get something back in return. It's just the safety and security of all of us and so much that they gave. So for me, wearing the uniform is to honor my brother, to honor my uncle, to honor all my family members that have served, that are not here with us anymore, and the ones that are still here. And all those people from Puerto Rico, as I am, that have worn the uniform with a lot of honor and just because they were given to other people. That's the meaning of wearing the uniform for me.
That's great. I would say that my experience is a little unique. And as I reflect on this question, I think the thing that comes to mind is one of my proudest moments being in the Corps was the opportunity to work with a very small group of officers many years ago and stand up the newest minority advisory group to the Surgeon General, and that's the Sexual Orientation and Gender Diversity Advisory Group. And to have the opportunity to be their first vice chair, second chair of that group. And that group Luz is a voting member of that group. But I think for me, one of the things that I've focused on for women in the Corps is I've always really focused on what the experience is like and how do we support minority women in a uniformed service. And these are non-binary people that don't identify as male or female, transgender women, and queer women, people that identify as lesbian. And really, whether that's we're advocating to the Surgeon General and headquarters around policy and procedures, whether we've advocated around adoption and leave policies, around how we identify the term parent. But that's always just been so important to me. And especially because many of our officers, especially clinicians, they've worked in rural areas or challenging areas, Bureau of Prisons, Immigration Detention Center, Indian Health Service. You know, my wife and I have lived incredibly rural, you know, definitely counted as frontier. And so just knowing that we have officers that don't have a lot of support and making sure that they feel connected to the Corps.
Thank you so much. Those were both incredible responses. So now I'm going to turn to the chat and get some of the questions that we have. Jamie Noah, thank you to the Pawnee Nation for joining us. And then we have a question. Could you please share more about how we are increasing access to care? What tangible resources are we putting in place to increase access to care? Great question. Thank you.
I don't know, Shannon, if you want to take that or if you want me to take that.
The mute button would come off. Sharyl, if you want to kick it off, and I'll follow
Okay.
up.
So the main way that HRSA expands access to care is funding FQHCs, federally qualifying health centers, which are low, no cost, comprehensive, integrated primary care with dental, pharmacy, and behavioral health addictions treatment. Those clinics are located in what we call health professional shortage areas, HRSA score areas. And so this is for decades before the Affordable Care Act, people that are underinsured or uninsured could not be turned away based on ability to pay. So this ability to just get primary care services, that is the main way HRSA tries to increase access to care. The second main bucket is the Bureau of Health Workforce. And what that program does is it really supports loan repayment scholarships or scholarships to pay health professional tuition as they are going through school to increase the amount of clinicians, especially in rural areas and other areas where there aren't enough clinicians. So I myself was a National Health Service Corps loan recipient for 8 years and paid back my entire master's and doctorate degree as being a part of the HRSA programming. So this is a way that we're trying to increase clinicians in these professional shortage areas. And the goal is then to keep people in those communities. There are definitely people that move on, but people that I have worked with throughout my career that have stayed in the community that they originally went to serve for a loan repayment and became very embedded in that community. And then lastly, we have been putting some new funding opportunities more into higher ed specifically, and really supporting faculty members, supporting students, and we have expanded the health professions. So we've really put some new money into prevention and Masters of Public Health programs, as well as community health workers. So that's just a little, tip of the iceberg of what HRSA is working on.
Thank you for that, Sharyl. And for CMS, access to care is really integrated into everything that we do. So I'll just give you a few snapshots of things that we're doing. So CMS has 16 what we call Medicare certified providers, to which FQHCs that Sharyl just spoke about are one of those 16 different types of providers. We cover rural communities, we cover small rural-based hospitals, and ensuring that those facilities still have viability and can meet the needs of those patient populations. Those are called critical access hospitals. We cover the gamut on that. We also, CMS is one of the few agencies within HHS that we have our own Office of Minority Health. And that is, so we work in collaboration with the department, but it really is to keep CMS's focus on ensuring that we're addressing health equity. And oftentimes when we're looking at health equity, that's also addressing access to care as well. CMS now has 6 strategic pillars that we're focusing on, where access to care is front and center and prominent in the agency as well. Within the Office of the Regional Administrator, we are responsible for local engagement, education, and outreach. So this is to consumer organizations across the country, as well as to provider organizations. And so that's one of the main areas that we're looking at as we're talking to hospitals and providers and others, really is about access to care and how they are engaging that. And so we really see, because of the large payer that CMS is, we really see our opportunity in having those discussions to be able to broaden the conversation and to really be able to advance that initiative as well. And then obviously through the marketplace insurance, that is one of the biggest areas that across the country, we are ensuring that high quality, affordable care is provided. I know Sima probably knows these stats in the back of her head, just of the cost of premiums, the way we've been able to reduce those cost of premiums so that it really does provide the access for individuals to be able to have healthcare coverage. So those just kind of a snapshot of what CMS is doing as it relates to access to care.
I mean, kind of to add to what Shannon was saying is that there is huge emphasis at HHS to increase access to health insurance coverage and really to move us closer to our destination of helping ensure better healthcare, and better health coverage for all people. And really, this past open enrollment, we had so many more choices and affordable healthcare options available, some of them just under $10. And I just have to say that it's incredible that our total enrollment for Medicaid expansion marketplace and the basic health insurance in participating programs reached an all-time high of more than 35 million people as of early 2022. And of course, CMS has done an incredible job with the Navigator program in this region alone, how much it's been. We have a lot more work to do. Obviously, we want to make sure that we can expand all the Medicaid programs, because state Medicaid expansion would be a key step to advance health equity. Really, of the nearly 4 million uninsured Americans who could gain coverage, it would, that would really, in these states, if they expanded the Medicaid programs, more than half are people of color. So just really working to make sure that we can help out and working with this incredible group, CMS, HRSA, to get that information out there to provide health insurance to everyone.
Thank you so much, Sima. I just wanted to acknowledge the CHWs, the community health workers, because they are key, crucial in getting this message out and to spreading public health. So I just wanted to acknowledge them and say, if you need anything, reach out to us. Because like Sharyl mentioned, we do have some new funding for community health workers. So please reach out to us. And also, we have a note here in the chat: in addressing immigration and other health disparities, I would like to see more funding for community health workers and training opportunities to certify medical translators so that we can bridge the culture gaps in healthcare education and prevention. So Sharyl, I don't know if you want to touch on the HRSA funding that just came out. Oh, you're on a mute.
Sorry, you would think after years of doing this, I would manage that. I don't want to misspeak. I don't have the NOFO pulled up right in front of me right now. And so I don't want to give inaccurate details, but hopefully all of our information will be shared. My colleague, Stephen Richards, is on this call. He just put it in the chat. God love him. Thank you, Stephen. Teamwork makes the dream work, right, folks? So yes, feel free to go to that. Also, we'll give you our, hopefully, Lieutenant Geiger, if you're giving folks contact information or with the recording, because any of the programming that you're interested in that HRSA has, we at Intergovernmental External Affairs, we have 2 public health analysts and really do our best to help connect you to the correct either funding opportunity or bureau office at HRSA to get your question answered. I will say, I was about to put it in the chat, and maybe someone else already has it, but thank you for talking about medical translationists. Like, I did one of my rotations at World Relief and did psychotherapy with refugees, and it really matters to have medical translation versus, using family or support folks around the person. And so we rely heavily on the national class standards here at HHS. And if people aren't familiar with that, I'll just go ahead and put that link in the chat, but it's just another great opportunity to have your organizations and communities really look at cultural and linguistic competencies in healthcare.
Just as an addition to that, there's a big commitment on all these grants for community health workers and other support to make sure that the people providing it are as diverse as the people we're going to provide these services too. So as far as language background and all of that, so there's a big emphasis on making sure that that's also out there in all the programs.
Thank you so much. And we only have 5 minutes left. So I wanted to close with, what advice do you have for aspiring female leaders in public health?
Well, I'll jump in there. One thing, and I think it's really been said in various ways before, but really prepare yourself to take advantage of the opportunities that come your way. And that may be through increased education, as Sharyl mentioned, or it may be through being willing to stay committed to a mission, but change your organization, as Shannon has mentioned. Mm-hmm. I really think that a lot of times we put ourselves in boxes, particularly as women, and we have to be willing to push outside of those boxes and take advantage of those opportunities, and being intentional about your career and the goals that you want to achieve. I know that was something that was advice that was given to me, and it really helped along the way to take a look at my career and ask myself, where are the gaps in my career, and how do I fill them in order to get to where I want to go? Learn the power of no. I know that my team knows that I say that a lot. There's power in no. And there's ways that we say no, and we can say no with encouragement. No, but here's another solution, or no, but here's another resource. But really, it makes a difference, because a lot of times I feel like we burn ourselves out because we do so much, and we're always saying yes to things, when there really is power in no. And control your own story. Be proactive and persistent. When I thought about, what I would say and how I try and live as a person in my career, that's one of the things is really trying to control your narrative.
I would say I completely agree with everything Lakesha said. It's really also be resilient, be passionate, and be relentless. I mean, you're going to have adversity come your way, and just don't let that stop you. That's just going to make you stronger. And there's just too much at stake. And you really coming and doing this work, it's so, like, you can't imagine how it will make you feel when you're able to help just that one person. It really makes a difference. So just don't give up. I mean, I always love Maya Angelou saying, and I always have it written next to my desk. So, I mean, I don't have it memorized, but I always have it here. It's like, I can be changed by what happens to me, but I refuse to be reduced by it. So just stand up, and, you can do whatever you want, and just don't give up. And if we can help you on this panel any which way, please just reach out.
I think to piggyback on what you said, Sima, there's this new term that's going around, especially after COVID, this idea of toxic positivity, and what you just described is the opposite of that. That toxic positivity is sometimes used to encourage women to not acknowledge the challenges that you're facing in the workforce, in your work-life balance, in the different seasons of our life. So the challenges that I faced as a junior officer look different than when I was a nanny, that look different now, kind of my mid-senior career side of my life. And so do not feel like you have to be all rainbows and sunshine and have toxic positivity. Be realistic and be honest with the people that you feel like you can be authentic with, to get the support and help you need. Because burnout is real. And one of the ways that I do that is what you just described, Sima, which is what inspires me, what matters to me, and how do I find my colleagues that can help me along the way. Yeah, thank you.
So Monica, I know we're at time. I don't want to keep the group over.
Oh, go ahead.
Do you have a minute? Okay.
Yeah.
So I just want to leave you. So everything that the women have said has been absolutely spot on. So I'm not going to repeat it, but I want to leave you with this quote. It's by Charles Swindoll. And one of the refrains says, I believe life is 10% what happens to me and 90% how I react to it. And the reason this is so meaningful for me, there was a time in my career where I was a GS-12 for over 10 years. And I was frustrated, angry, cranky, believed I should be in another position. And someone gave me this quote. And they said, you need to remember who you are, what you bring to the table, and never let a grade determine you. And I wish I could tell you just magically, I was like, yes, no, I was still pretty cranky and irritable for a while. But after a moment, I really did commit to myself. I said, I'm going to work, prepare, be focused, diligent, determined, as if I'm a GS-15, whether I am or not. And so what I would say is if you have a goal, hold to that. But there could be times in your career where you're going to be stuck. There could be times where you're doing somebody else's job. There could be times that you're doing 10 times more than somebody else. Do not let that dissuade you. Don't feel like you're being put upon, because what you learn here and what you have here in your heart can never be taken away. And if you continue to persevere in time, you will see the fruits of your labor.
Wow, thank you so much. And with that, thank you everybody for joining us today. And thank you ladies on this panel. This has been an amazing discussion. And I will be sending out the recording, so please look out for that. And thank you everybody. And I'll leave you with one of my favorite quotes, which is from Mark Twain. Broad, wholesome, charitable views of men and things cannot be acquired by vegetating in one's little corner of the earth all one's lifetime. So again, thank you everybody for joining us. And I hope you all have a great rest of your day.